Hey, what's going on, everybody? It is us, the Melanated Council. Boom, boom, boom. We are here. I know we're missing one. He'll be here. Trust me, he'll be here.
Yes,
He'll be here.
he's on his way.
Yes. And so typically we try to get started around 9 o'clock, but every now and then, we kind of woosah before we get to this, and make sure we have a good discussion and everything else. So
Yeah, for sure.
So I know everybody's wondering, like, what is today's topic? Like, what's going on? So we're talking about COVID-19. This time it's looking like round two for the most part. And we know that several states are experiencing some record highs since last year. And we also know that there's some states who are getting hit not as hard, and it's just a lot of stuff that's going on, What you mean?
Yeah, we jinxed the hell out of this.
Man, listen here. Ain't nobody jinx nothing, sir. Respectfully.
Unless he's talking about Florida, then I mean, yeah, kind of. No one would expect Florida to be on the right side of history.
I'm gonna say, as long as y'all's governor is, I don't think Florida will ever be on the right side of history. I don't think. My opinion, just looking from outside in. My opinion.
Mm-hmm.
But at the same time, sir, we do have ways of making things happen. So you just sit right there. I got you. This whole COVID-19. What are you looking at? Like, what's really going on? And if you want to talk about what's been going on in your state, go for it. Let us know what's going on.
I mean, Ron, that's a great question. What is going on in my state? I wish I knew. I wish I knew what was going on in people's heads. So we experienced a record high cases and record high hospitalizations, I think, yesterday, and then we broke it again today. Our governor doesn't report on our cases and deaths every day. It's now weekly. So that's, I don't know, kind of authoritarianism-y, at least to me. I feel like this is information we should be allowed to know. He likes to say that it's because of like media hysteria. I can't remember the exact terminology he's used, but some sort of media, I don't know, like I guess how the media hypes up coronavirus, as if it's not a serious issue. That's what's causing, I don't know, all the craziness and hysteria, even though, I mean, the numbers don't lie, even though he's been trying to, fudge the numbers a bit. I think it was today or yesterday, he said, I guess about when somebody asked him about mask mandates or whatever, he said, oh, I'd rather have like 5,000 20-year-olds get COVID than 500 senior citizens. And that's, first of all, this shouldn't be an either or situation. This should be like no one should be getting cases. It's like, it should be as minimal of people as possible, no matter what the age is. Hospitals are, getting filled because, and like the people going inside the hospitals tend to be younger. So, that's been very unfortunate. I know that people love to obsess about the death count and the death numbers. I don't really know why. They just need to hear something that makes them feel as if this isn't a big deal. I feel like it's some sort of like pendulum swing where there's a group of people who are on one side saying like, this is really, really bad. This is serious, blah, blah, blah. There has to be another side of the people on the opposite side of the pendulum saying, this isn't a big deal at all. Most people live. Like, okay, yeah, that's good, but you're not really taking into account of the people who get hospitalized, get, ventilators, get, or just get very, very sick. And we don't know the detriment of getting sick today and how it can affect people, in the future. Like, we still don't really know that the virus is still relatively new. It's 2 years old. Not even. It's almost 2 years old. And so just because people are most likely living, it's like, okay, now this person is living with like this disease, or this person was sick for weeks and months on end. It's like, that's, you're making their life feel, you're making their life seem insignificant because, oh, okay, this didn't happen to you, or you just had a mild case, therefore it is not bad. It's a very like, I don't know. I don't know why people can't really, like, as mindful skeptics always says, like, people can't see past like their own nose, and it's like sad and disgusting. Like, I mean, yeah, I'm not perfect either. I've been vaccinated, which I'm really happy and grateful for. I was actually in a situation where I was around people who a lot of them were vaccinated, which I was happy about. But there was like this one person who apparently tested COVID, like positive for COVID 2 days after I was around them.
Mm-hmm.
And this isn't like this was just somebody else who was, like in the space that I was sharing. And fortunately, I was tested, and I waited like a week or so, and I tested, and actually it was today, and I tested negative. So yeah, sorry, yeah. It's just like the negative, like it's written in green, so you kind of want to say positive because like green is a positive color. Like, I was like, I tested good. I was like, well, what does that mean? Like, tested, because like negative's usually like bad word. But anyway, so right. So it's like mild. It's like a smidge. I don't know. Anyway, so yeah, so I tested negative, but I had appointments. Like I wanted to meet up with my trainer that week. I canceled that. I wanted to meet up with my therapist that week. I had to cancel that. And I was just like, really pissed because I was like, okay, now I have to wait to see if I have this thing, this. And even though I know that I would be fine, I don't know who these other people interact with that I interact with, like a little bit more closely. And it was, I'm like, how do people just go get tested and then go to a party or something, or like go out and do things, and then just not eat, and then like a couple of days later find out that they're COVID positive.
Right.
And we're like, oh yeah, my bad. It's like, so when did you get tested? Why would you come out if you thought that you could infect other people? Like, that's
right.
Like, especially come out maskless. Like, it's one thing if like, oh, okay, I could be positive. Let me just wear a mask and try to be, try to stay away from people if I have to be out, in order to do my stuff. So I understand that there are people who like live by themselves, so they have to go to the grocery store, get and do the things that they need to do. And I understand that. But just have the respect and wear a mask.
Right.
Especially if you think you could have like been exposed to COVID.
Right.
Like, I feel like it's the same thing. It's just like wearing a condom. Like if you're about to, like have sex with somebody, it's like, I don't know. Like this is how I think. Like
you true.
Right.
You true.
Yeah, I mean, it's not like, oh, I know that I don't have anything, so I'm just gonna go raw all the time. No, that's not what I'm saying. But like,
I hope not. Sheesh.
No, but it's just like, oh, I could possibly have something, so let me like protect myself and protect others, so I don't spread it. But I don't know. I just feel like it's just a very selfish way of thinking, because it's like, okay, you might be infected, so put on a mask. Try to limit yourself around other people. Everyone would understand. And if they don't, stick up for yourself, set that boundary and say like, no, I don't want to infect you guys. on the off chance that I actually do have it.
Right. Right.
But, yeah.
Agreed.
So I don't know if you like I mentioned earlier that Florida's governor DeSantis, he was saying how he'd rather have 5,000 20-year-olds be infected than 500 like senior citizens. I'm like, regardless, if you get infected, and I kind of sort of mentioned this, like you might go into the hospital and then you're taking up a bed. And then, other people who really do need that bed, if they have, like have a stroke or a heart attack or other sort of, or if anything happens, now like it would be a little bit more difficult for them to be seen, or it might take a lot longer. And also you're stressing out the medical staff. Mind you, the medical staff isn't like some robots. It's like just because you can access them every day 24/7, they're not like fucking Walmart like self-service cashiers, like the self-checkouts. Like that you can't just go into a hospital and do everything that you need to do by yourself and then come out. Like people have to help you, people have to assist you. And there's a limited amount of people. There's not, you don't have just a limited amount, like there's a set number of people on this earth.
Right.
And there's some that get into the medical field, and some of them are in your area, and like we just hope that they're fine and like they're willing to like help you, and that they that they're not overworked, overstressed, that
Right.
like I feel like we give so much empathy to police officers, where we have to be super nice to police officers on the off chance that they might have a bad day. It's like, okay, but we're just going to really put the middle finger up to our healthcare workers and our medical staff and our EMTs and everything, just by doing things unsafely that you have no idea how it can affect you. And just because you might be young, you think that you're healthy, or like you might be healthy, you don't know how this virus might affect you. And even though you may have already been infected, it's possible for you to get infected again. You don't know how your body is going to be when you get it. You have no idea.
Exactly. True.
Yeah.
True. And I can speak from experience, because it's like the eyeball of it happening was like, yeah, we knew it was going to happen, but we didn't know like when it was going to happen. And so even though we masked up, sanitized, we did everything possible the first time around, now is like, man, it sucked for anybody who hasn't had it. It's pretty much like the worst pain imaginable. And you may not even get hit with all of the symptoms. You may get hit with one or two of them, but still, it's like it's horrible. And so I know just recently here, I find myself whenever I do go out in public, just to always have a mask on me and a mask up, because it's getting to the point where now it's like, yeah, even though I'm not vaccinated yet, as that point goes, and again, it is not because I don't want to. No, it's not even that. It's just a simple fact of the matter that I have 3 kids who aren't really eligible to get vaccinated as of right now. And so it's kind of like, crap, what do we do? Which is going to be another question that I'm going to ask later on, because even though, yes, they're still doing A, B, C, and D, it's a simple fact of the matter of them being caught in those crosshairs, especially when school starts. It's like, what do you do? And so it came to the point where I myself are saying, once I know like my kids can get vaccinated, I myself will get vaccinated. I know my wife, she has to get vaccinated because she is a CNA. So she is a healthcare worker. So she has to. She had no choice. She had to. But even still, it's like the knowing that Delta variant is still flying around. Even then, even her herself, she's masking up just due to the fact that she already went through it once before. She's like, even though yes, I'm fully vaccinated, I still don't want to get it. Like flat out, I still don't want to get it. I still don't want to go through the same thing I went through the first time. Even though, yes, we all have mild symptoms, I still don't want it. And I
Right.
can't blame her. I don't blame her, you know? And it's a good point that you brought up too, El, where you're saying how, like, even though, yes, we may think we're young and healthy, that you don't know how this Delta variant is going to affect you. We don't. You know, even most of the times, the CDC is finding themselves kind of like double backing on what they originally said and saying, well, maybe the mask mandate may need to get put in effect, you know. And even though, yes, you may be outside and everything else, that's fine and dandy, but, you know, still be cautious and still be leery, you know. And even then, you still have some states who are still in like phase 4, phase 5, because they're still trying to get people not only vaccinated, but they're still trying to keep their numbers down to the point where if anybody comes to visit, that those visitors, they don't get infected. You know, and it's hard. It's hard. It's really, really hard. So I say all of that to say, do your due diligence. You know, like Mark said in the comments, you know, be responsible. Have enough common sense to know, hey, we're still not out of the woods yet. We still got some ways to go. Do your part, protect yourself. You know, stop the spread, regardless if you're vaccinated or unvaccinated. If you need to wear a mask, wear a mask. It's okay. It's okay. Nobody's going to shame you. You know, if anything, they may applaud you because, like, okay, we understand that, you know, you're trying to do your best to protect yourself. Okay, cool. Yeah. You know, it's not a game anymore. It's really not. You know, once you see the numbers increase as far as hospitalization goes, once we see the numbers increase as far as those dying from it increases, it's slowly going to trickle in to the point where that could be me. You know, I could be. And go ahead.
Just because you see a number, each number is a person. It's a human being.
Yeah.
It's a brother. It's a sister. It's a dad. It's a kid. You know, it's a teacher. It's a doctor. It's a friend. It's somebody. Or I feel like numbers can definitely like desensitize us, especially like percentages, likelihoods, and things like that. It's like, you know, be happy that, you know, this thing isn't as deadly as, you know, other, like, you know, like Ebola or something, because it would have been outrageous. Because I don't think the news, I want to say news, I don't think the misinformation and the propaganda would have changed much, honestly. I think it would have still been like, you know, well, you know, like once it gets to like 5 million dead, then it's, you know, in a day, then it's serious or some bullshit. Like there's always going to be like some bullshit to make certain people feel okay. And it's sort of unfortunate that this is the society that we live in. But I don't know, like I really don't think there would have been anything that would have like really changed people's minds to make everybody come together. I really think this is just how warped everybody's like, you know, like a huge portion of America's, you know, minds are. I wouldn't say everybody, but like a huge proportion of Americans' minds are. It's like, why the fuck did we make this political? Like this,
exactly.
that was the stupidest thing that has ever happened. But it's the same like pendulum thing that I mentioned earlier. It's like, I guess they assumed Democrats were caring about this more. I don't know. I guess the masks thing, and I guess they probably tried to equate that to China and you know, just Eastern Asian populations that tend to wear masks. I don't know. I don't know how this.
Yeah.
I knew it was more of like a cultural thing because. You know, if you ever watched anime or, you know, gone out east or even watched, I don't know, like some news thing, like somewhere that's in on like Eastern Asia specifically, you probably see somebody just walking around with like a medical mask. And I don't know, I've watched anime pretty much my whole life, so I always knew that they wear that when they're sick, you know? And I was like, oh, that's smart. When I went to Japan, I saw some people, you know, wearing them. I was like, okay.
Yeah.
Um, yeah, and then I don't know if it had. I don't know if like it was. Of course, there's like a cultural difference. Like here, like in Western society, we don't really do that. Even though I always thought it was a good idea, it's like it makes
Mhm.
sense. Um,
Mhm.
like they're
Mhm.
most likely onto something. Um, but I had a feeling that maybe it was just like the cultural thing where it's like, oh, wear a mask, and it's like trying to equate that to China, and China's like communism and blah blah blah, and they're trying to they like to say that we're trying to be like the left is trying to be like communist or socialist or whatever the buzzword of the week is. So I don't know if that's what it was, and
Mhm.
like left like liberal tend to be like more science based. I guess like they tend to believe in science more.
Mhm.
Which is I don't know. It's like I always think that's so weird because like didn't everybody grow up learning science in school?
I mean, we did. I mean, I hope so. Everybody had a science class. I mean, who hasn't dissected a frog in science class?
Right, or just like learned about like photosynthesis or something.
Yes.
Yeah,
Yes.
yeah, like or like the rock cycle or the water cycle. That that's science. And but I don't know. It just became like a liberal left thing, and I don't know if it was just because it was attacking New York at the beginning of it. I don't know how the hell it started, but it was just the stupid left, like the stupid pendulum swinging where oh, whoever started what was on one side of the fence, and the other tried to overcompensate by trying to go to the other, like way onto the other side, and it just
Mhm.
sort of became like this weird reactional battle,
Yeah.
and
Right.
it was just very weird because I'm a huge believer of it's better to have something and not need it than to need it and not have it. For
Yeah.
example, it's better to just wear a mask and not need it than to need a mask and not have it. It's better
Hmm.
to me. It's better to have to be vaccinated and not need to be vaccinated than to need to be vaccinated and not have to be vaccinated.
Right. Right.
And just from just seeing the data throughout this entire time because I was following coronavirus since I felt like I was late. Like it was like February of last year, but I know that things started to really kick off in March. Like one of my
Mhm.
friends just kept, and he was like, I mean, like he would just like send me random stuff, like random like science news articles, and he kept sending me stuff about coronavirus. And I was just like, why are you sending me this? And he was like, oh, you don't really care about it? I was like, I mean, it's something that seems to be in Asia. And then I started to like, I got curious and I decided to see if there was a subreddit about it. And there was like 600,000 people already in the subreddit. I was like, holy shit, I'm late. But if you check it now, there's probably over 2 million.
Mhm.
And, I was like reading about it. I was like, holy shit, this shit is serious. This shit is actually really serious. And I really started to like, I wish I prepped more, but I really started to just be very mindful and, it started to kind of freak me out. I was like, this
Right.
is this is very concerning. And, I saw people in the comments talking about, masks and all that. I mean, it took me a long ass time to get masks, but, I made sure to like force my mom to like try to cover up. I kept forcing her, like, Mom, you have to start working from home. I don't care. You got to do it. You got to
Yeah.
figure it out. We got to figure this out. And, I started working from home kind of early, like earlyish March, but it was, everything just kind of came like just tumbling down, and it was starting to get very scary, very serious. Like I
Mhm.
started freaking out. Like some of my siblings were making fun of me. Now they realizing that it's well, they've been realized it that it was pretty serious, and like they for the most part got vaccinated. But like I guess long story short is it's just better to have it and not like wear a mask just in case it doesn't hurt. We have so much evidence on it. We have so much like data on it that it works. People
Mhm.
are upset. I think people are more so confused than angry, but like they just show their confusion through anger to not show any sort of weakness because nobody likes to be wrong anymore. I mean, I love it when people teach me the truth because then it saves me a lot of fucking time to like do shit myself. you
Right.
know, Yeah, you just tell me the truth at the beginning. But if you're starting to say, but if you start saying things like, oh, they want to wear a mask to muzzle us, I'll be like, but surgeons wear masks for like 17 hours doing like a back surgery. I don't, I don't think that would, like Asians, Eastern Asians have worn masks for like ever. This doesn't really make any sense. So like if somebody was saying something like that, or oh, they're just trying to control you, I'm like, uh I don't like what would be the purpose? What good would that be to see everybody wearing masks? It's like, oh, we got them under our control. It's like they control us in so many other fucking ways, as to like we don't have
Mhm.
universal or a single payer healthcare. That's them controlling us. We don't have, there's so many other things that, aspects that, we've talked about like a million times. That's their way of controlling us. Like, what is the mask? Like, it's like if you can't see everything else, what would the mask really be doing? And also, they need us to be alive so we can give them money. So why would they try to kill us why would they try to like mass murder us? Like what would that do?
God.
Like,
Well,
I don't know.
and it's funny. It really is because, of course, me and the missus, we talk about topics like this like all the time, and it gets to the point where it's like, okay, we know that the pandemic is real. We know coronavirus is real. There's no sugarcoating. It's real. It's real as the sun rising in the sky and setting, and the moon comes out. We see the stars. It's that real. Okay, why in the world are we still playing around like it's not going to do any serious damage?
Mm-hmm.
And even in our Republican city, irritating as much as it is, we see more and more people are wearing their mask more often than none.
Okay.
And at first, don't get me wrong. At first, a lot of people are like, yeah, we get to breathe and everything else, like, yay. But when this Delta variant was sweeping across the other side of the world, and it was like, okay, is there a possibility that it could very well come into the United States? They're like, yeah. So what they do, they went ahead and put back on their mask, and it was fine.
Mm-hmm.
And I'm seeing it, like I said, this was probably like we're in the first 2 days of August. This was probably back like the first, because I know Michigan released this mandates July 1st. Okay. And so probably like the first 2 weeks, everybody was kind of like, yeah, woo, we don't have to wear a mask. But that third week, I was seeing and watching people slowly transition back into wearing that mask.
Mm-hmm.
And especially once the Delta variant started making its way over to the United States, and we're seeing a lot more cases of people getting hit with the Delta variant. And again, it seemed like week after week, I'm seeing a lot more people wearing a mask. And regardless if it's people that are vaccinated or unvaccinated, I'm seeing a lot more people wearing a mask. Yeah, and even then, when we took the trip out to Illinois, like I mentioned before, they're still in phase 5. They're still in phase 5, and so there was
phase 5. I don't quite. I mean, I live in Florida. I don't know what the fuck anything is.
Okay, so phase 5 is basically saying it's basically put it to you like this: travel at your own risk.
Okay.
Travel at your own risk, and even then, there were like several counties that it was already mandated. You need your mask. You need it. Like, no hands down. You need your mask. In the part of Illinois that we were at, we were in Gurney, Illinois. That's where Six Flags is at. Even though the theme park was saying, you don't need your mask, we still had ours just in case, because of the fact that we don't know what's going on. And then the county that Gurney sits in, it was more so of if you're inside like a building to wear your mask, but once you're outside of that building, you can take your mask off. It didn't matter if it was a hotel, restaurant, store, it didn't matter. Have your mask, wear your mask. And even then, they had it plastered before you even got into the door. No mask, no service whatsoever. Didn't care. They were like, no, we were trying to keep our numbers down. And I think the county that Gurney is in, their numbers were a lot lower than a lot of the other counties in Illinois. So we were like, okay, cool. We get it. We have our mask on, we follow the rules and the regulations and everything else. So basically, phase 5 is pretty much the highest phase of them all until they make another, like, let's say phase 6, then sheesh. That means everybody's on lockdown. But yeah, phase 5, basically travel at your own risk, wear your mask, have a mask, because certain areas were a lot more contagious than other areas. And so we're like, okay, cool, no big deal. Like, we get it, we understand. And even then, as we were leaving Illinois, going to Indiana, it was still pretty much the same thing. But even then, I think Indiana, they released their mask mandates, but even still, we were still finding ourselves wearing a mask, just because of the fact they wanted to keep their numbers down. And I feel as though that as the months roll on, which transitions into this next part, talking about the schools now. As we transition into August, knowing that schools across the country are starting to go back into session, the thing now is, and I posted in the chat too as well, is like, once school starts back up, do you think that the schools and the school districts, are they going to be reinforcing, I should say, the mask mandates, especially the K through 12 sector, regardless if those students are vaccinated or not? Do you think that the mask mandates may be applied then? And whoops.
Wait. Repeat the question. I'm sorry.
Okay. So question is this. As school is beginning to open up and go into session, do you think many school districts are going to reinforce the mask mandates, especially the K through 12 section of schools?
I think they will, at least, around like the saner parts of the country. Well, I wouldn't say saner parts of the country, but like states that don't have, stupid ass governors. Like, they would definitely. I don't like.
Oh, about that.
Yeah, so I did want to mention what had happened in Florida. So Governor DeSantis said that he's totally banning schools from issuing a mask mandate, and like districts or whatever. And if any of them does, then he's going to withhold funding to those districts or those schools. So I find that to be incredibly odd, because my governor, Mark, he's not my governor. He's
I figure out why you use my girl's part of her government. Be incognito right now, sir. Incognito, supposed to blend in, not stand out. No, we gotta blend in. We can't be doing this.
So I don't know. I don't think he's even going to care if a couple of children die, depending on which county it's in. He knows that the cases are going up in the more liberal counties because we're just more populous, like Miami-Dade and Broward. So that's what I'm assuming. That as sickening as that may sound, but like. It's just very crazy. Broward County was trying to, County was trying to issue a mask mandate. So I think that's what the parents voted on anywhere or something. I don't know, but it's just very weird when people are like, "Oh, thank you," like in the comments, like, "Thank you, Governor DeSantis. It should be up to the parents to make the decision for the kids." I'm like, I mean. I don't know, like that's such an iffy thing, because like I get it, but it's like, I don't know. Like, how does the kid feel though? You know,
Agreed.
because like when you're if you're 17 years old and like your mom curses you out for it's like, no, you shouldn't wear this mask. You have to breathe God's air or whatever the hell. Um,
Oh my God. Oh my goodness. Don't give me that might be the next section because this message is going to drive me bonkers. Go ahead. Go ahead.
Cool, but so
Go ahead.
like, and then once that kid turns 18, then they could just do whatever they want. And it's like you just went from 17 being in control, your parents controlling you, then 18 you can do whatever you want. Like, I understand that that's just the age of being an adult, but I don't know. I just think that's just really weird because I'm sure there's a lot of kids who are like 5, 6, 7, 8 who have so much anxiety because they want to wear a mask. Like they've been probably watching like some TikToks or something, just learning about it, and they've been probably hearing about people like little kids also getting hurt, or they're probably heard of like kids passing it on to like their parents. So they're probably feeling all sorts of anxiety, like these little young children, and they just can't do anything about it because their parents just believe in this particular thing. So like, I don't know, like it's very heartbreaking.
Mm-hmm.
I mean, there's so much. I just think it's odd how there's just so much like data on the effectiveness of wearing masks and how there's, I've heard it, like, I mean, of course this was on CNN, so I don't know like how like accurate it was, but because this particular doctor, this like ER nurse, I don't know what he was exactly, his position. He was like very angry. He was saying, "Oh, it's like, oh, it's always the little kids that are helping the adults put on their mask correctly. The kids are okay with wearing masks and all that." And I'm like, it's just one of those things. Like, you go on CNN, you hear one thing, then I'm sure if you go on Fox News, you see the complete opposite. And I don't know. It's just very, very. It's just very ridiculous.
Mm-hmm. Mm-hmm. Oh yeah. Oh, it don't stand for Republican National Committee. It don't stand for that.
I figured as much. I'm like, hell no, you're not in the RNC family. Not today.
No. Oh no, that one we won't talk about off stream. But no, this is one of my homies from another group that I'm in, okay. and pretty much he's in it. There's another person that shows up. Yeah, I'm glad to see you, sir. Thank you. Thank you for supporting. Thank you. But yeah, oh yeah. So what was I gonna say? He threw me off. No, the mask mandates, yes. I find it very odd. I will put it like that. I find it very odd that people, especially when it's time to go to school, the parents of the students, that they're not saying, go ahead and wear your mask, or at least keep it in your backpack, something, because you don't know what you're going to go into. And even then, we know that the majority of the kids that are going to school, the majority of them, they're going to be unvaccinated. So that's going to cause a really big issue, because you're going to have another group of kids, they are vaccinated. So it's like, so what do you do then? Because now you're literally going to create an environment where if the kids who are not vaccinated, if they contract COVID from somebody who's either one, not vaccinated, or two, already vaccinated, what are they going to do? And even then they bring it back home to the parents. How's that going to affect the household as a whole? And I feel as though mask mandates should be mandated. I feel as though we should be going back to that, because of the fact we don't know what's going to happen with this school year. And again, a lot of people have to understand that the school year, of course, we're going back to school where not only are we dealing with COVID, but at the same time, we're going to be dealing with the flu. So it's like, come on, make it make sense, okay? Make it make sense. I remember, oh, let's see, what's this, 2021, so 2020, so 2019, I was hearing about COVID, and I was already peeping the signs like, man, if it hits the United States, we're screwed because not a lot of people are going to take it seriously. Not a lot of people. And even then, come January, February, I'm talking to my supplier. I'm like, hey, what can you do to get me hand sanitizer, soap, mask, like the whole kit and caboodle? What can you do? He was like, dude, if you don't put in an order now, more than likely you're not going to get it because all the healthcare workers and all the healthcare facilities that we pretty much deal with, they're going to get it first. And once that supply is gone, everybody else outside of healthcare work, everybody else outside of first responders, y'all gonna get y'all gonna get slim pickings. And I told my boss, like, hey, we got to get on this. If we don't get on it, we're going to be screwed. We're going to be screwed. Like, we're not going to have a whole lot, and we're going to be pretty much be waiting on our back order to get refilled. It's not going to happen. It's not. And then on top of like, then you expect people to wear a mask here. Really, a lot of people don't even care about the safety of themselves. Come on now, we're breeding a disaster. What ended up happening? We didn't get our back order. Well, actually, no, we didn't even get our order. Everything got placed on back order. We got shut down. Of course, y'all know, lost my job, but whatever. I'm happy because that mess right there, people was catching it left and right. People was catching it left and right, and they were like, well, what do we do? What do we do? Like, y'all didn't listen. Duh, you didn't listen. Had y'all listened the first time, we would have been in the situation that we're in now. And so now is like more and more people, yeah, they're going, but at the same time, they're like, nah, it ain't working out the way how it is. And again, we're going back to school now. We're still within the pandemic, but it's like, it's going to be another wave. Again, COVID, round 2. It's not done. And it's like now we're going to be putting our babies at risk. Like literally, we put our babies at risk. And it's like we as parents, we can only do so much, And it's like if we don't push the issue to saying, hey, wear your mask. I understand you're going to be grown and everything else. I get it, but at the same time, just wear your mask. If you're not going to wear it, at least keep it on you. At least keep it on. So at least if you get into a place where you feel uncomfortable, mask up. Plain and simple, mask up. And even if you're contemplating on getting the vaccine or not, hopefully you'll be getting the vaccine. If you're in that age group, get it. Mask up. And even when you get the vaccine, mask up. Why? It works. It works. It works. The data speaks for itself. It works. And even then, once we get everything kind of semi under control, it's not about controlling. It's about being safe at the end of the day. It's about being able to live to see another day without being stuck in a hospital. I mean, I read an article where, intensive care units are overflowing with COVID patients, and they're making other rooms like COVID wards that weren't supposed to be, but now they are because the influx of people that are coming in. So now it's like, okay, if we know that the majority of people that are coming in are those that are unvaccinated and they keep spewing this, oh, it's not real, or oh, they're trying to control us. It's like, well, obviously something ain't clicking because you're on my table right now. You're on my table. Like, did you at least wear a mask? No. I'm sorry. I don't know what else I could do for you. Hopefully we can do something that's going to help you to live. But at the same time, it's like,
Can you highlight pajama thighs? Eight
Yeah.
hour waits at the local emergency in Central. I heard it's getting really bad in Central Florida.
Jeez.
Because the thing about Central Florida is that it's actually very rural. Like, I mean,
Hmm.
for Florida's map, Central Florida is where Disney is,
Okay.
and then like we always think about, oh, it's in Orlando, but it's actually like closer to I believe like this little rural area called Kissimmee, and
Okay.
then but it's like Kissimmee is 45 minutes away from Orlando, that's very far. That's a massive distance. And then there's like other parts like Ocala, Ocoee, and like everything is like very, very, very far. Like you can't live in Central Florida without a car. Like don't even bother.
Right.
And so there's like a lot of like little rural parts in Central Florida. So they
Mhm.
have to go probably like 45, 50 minutes to a hospital, like something like a ridiculously long distance. Or they might have like a hospital, but it's so tiny. And they're
Mhm.
just
Mhm.
so like, yeah, so I definitely believe that there are 8 hour waits at the local emergency rooms, and it's incredibly terrifying.
Yeah. I mean that in itself, it just speaks volumes of one, if you can get vaccinated, you know, and then understanding like if you have other reasonings behind it, hopefully you're wearing a mask, hopefully, because the one thing, like Ella has said, the one thing you don't want to be doing is caught slipping, you know, be in a predicament where you it's best if you had it and not need it versus need it and not have it,
Right.
you know. And that goes for pretty much anything and everything, you know.
Mhm.
And I mean, there's some places where you don't even need an appointment; just walk in, get your shot, you're done. You know,
Right.
do what you can do. You know, but at the same time, at the end of the day, please, at the end of the day, do your part to protect yourself and protect them. Protect yourself and protect other people. That's
Absolutely.
it. At the end of the day, at the end of the day, which leads to the next point because a lot of people, well, a lot of articles are suggesting that the majority, especially in Florida, the majority of the influx of people getting smacked around with COVID was due to Rolling Loud, just using it as an example, because of course we know majority of people there probably didn't wear a mask.
Oh,
Probably
right.
did.
That's for Rolling Loud. I think that was in Central Florida, right? Wait, was it?
Uh,
No, that
I
was
thought
in
it was
Miami.
no, that was in Miami.
Yeah, yeah. Rolling Loud was in Miami. There goes to show. I think one of my
Yeah,
friends was there, but she's vaccinated though.
yeah,
Yes, yes.
Miami.
Yeah, it was in Miami.
Yeah, and so
Yeah, but
again,
I
you
think
got areas like you know, that's kind of like, I don't want to call it like a breeding place, but more so like a central hub because that's where a lot of activity is at. But then again, you look at places like Massachusetts, you know, where the majority of their population they're vaccinated, but they were still able to contract it. Moving forward, you know, especially as the fall, as summer tends to kind of like dwindle down in most places, and come fall, what do you think is going to happen during the fall time, especially where we have a lot of these concerts that are picking up, a lot of fall activities that are not necessarily like outside, but more so inside? Like, what is that really going to look like?
mm, say that again. Sorry. No, I just noticed that your friend Superman Prime is from Palm Beach County. That's dope. Um,
Mm-hmm.
I'm just south of
I
Palm Beach. Okay.
half of Florida doesn't believe in masks. Yeah. Okay.
Yeah.
Okay. So basically, what I was saying or asking was, what do you guys think is going to happen once the summer months are kind of dwindling down and rolling into the fall months, especially with a lot more of the fall activities becoming available and opening up? What do you think is going to happen? Do you think those fall activities are going to require you to wear a mask? Or do you think that it's going to kind of like jerk a pluck?
So, like, I guess this question makes sense to you, Ron, because you live in a state that actually has fall. So, like with Florida, especially South Florida,
Mm-hmm.
um, I noticed that, like, I remember DeSantis did say that, oh, he feels like the spike in cases is going to go down because because it's the summer months and people are like inside more. That's like, what the fuck do you think a school is? So, and school for at least Broward County is starting on Monday. I assume
Mm-hmm.
the same for Palm Beach and Miami. If not, it's probably like a week or so after. But uh, that's true.
That's true.
That
That's
is very true.
true.
That is very true. But I don't I don't know what's going to happen. Like it's very hard to say. As sad
Mm-hmm.
as unfortunate it is, like in order for people to like for some people to really change, it's like it has to affect themselves or like their family personally.
Mm-hmm.
Like it's like we live in a country with a cultural mindset that's just like, oh, well, sucks to be you sort of thing. It's like, I'm glad I'm not you, or like, fuck you, I got mine, sort of like, mentality.
Right.
I remember I was reading an article saying that like people felt that when they traveled to the United States that Americans were just like very rude and very mean, and which I can sort of understand. Like we tend to be like quite selfish. So
Mm-hmm.
I don't really know. I don't know what's going to happen. Like it's just one of those things where it has to affect themselves, affect them or their family personally, and they have to not be like a sociopath or a narcissist,
Right. Right.
or like psychopath. I think it's psychopath. Well, sociopath too, or a narcissist for them to, for
Hey.
them to make a difference. Mark asked, "What do you think about vaccine passports and mandates?" I think they're wonderful, personally. Being in South Florida, like no one's like I probably got my ID, like my license checked maybe like 4 times in my life to get alcohol. But so I'm like sort of still wanting somebody to check something that I have. It's like, yeah, you see, I got this, I'm ready. But I think I like, I don't know if necessary evil is the right term. I feel like they just decided to demonize the whole, like, especially vaccine passport ideal. Like, I don't think
Mm-hmm.
that's necessarily a bad thing because I don't understand how that's like invading on people's privacy. Like
Mm-hmm.
I don't know. That's just like asking somebody to see like their STD or STI results. Um, like so. I don't really see anything personally wrong with that. It's like, hey, I'd like to know. I'm trying to protect myself. You're not the only
Mm-hmm.
person on the planet who needs to, feel safe and comfortable.
Right.
So
Right.
I sort of see it like that. It's just like, hey, I'm good. Like if you want me to like be far away, if I totally understand that. Like 6 feet
Mm-hmm.
plus away, I totally get that. But I don't see anything wrong with like being able to show like vaccine passports. I think that's a great idea. I wish I had like an app on my phone like Andrew Yang always like touted about. I think that would be great. Or
Mm-hmm.
like some sort of thing that just, you could like a QR code that you could just scan saying like, hey, I have my vaccine. If I just had maybe like a picture of my face and like the date that I got it or something. Because you can't just say like, yes, you've been vaccinated, and that could just be shared with anybody. But if it's like, hey, Elle, this is her face. She got
Mm-hmm.
vaccinated. She's good to go. I don't think that's really like that big of a deal, at least because it's not like something that's going to be forever. But it could be something that people could use for like other things. But I don't really know, and I don't really have the mental capacity to really think about it because I feel like that's like But I do think just having like, especially for this, this is an emergency situation. We're all doing weird things, like
Mhm.
I get, like I got a text message when when they found out that my test results were available. Like 2 years ago, that wasn't a thing. At least for like COVID-19. I mean, so like these things are new, and like we're just trying to adapt to the times of like what is
Mhm.
reality, what is actually happening. Um,
Mhm.
so I don't think there's anything wrong with vaccine passports. I actually don't think there's anything wrong with vaccine mandates, depending on like your job or schools or
Mhm.
whatever. Like there was a time, I think I was in middle school, where I had to like go into internal suspension for a day, because I guess my vaccinations weren't up to date or something. I don't like my mom called and cleared everything up or something like that. Like I
Right.
remember getting like the tetanus shot and I don't know, like other stuff. Got like the meningitis shot, going to college. And like my mom isn't like the most pro-vax person. Like she's pretty anti-vax. She was initially very anti-vax about like I don't think she ever got the flu vaccine. I never did either. I won't lie,
Mhm.
like she like somewhat could like influenced me, but I got the flu vaccine for the first time last year just to like I with my mom living with me, it's like let me just try to be as cautious as possible. Nothing happened. It's been probably like over a year since I got the vaccine. Yeah, she is actually vaccinated. Yeah. We kind of forced her to get vaccinated. But she definitely feels a lot better about it now because she was fortunately like of age. Like she was 65 on the dot, and
Mhm.
I was like, oh, thank God, we could get her vaccinated. My brother-in-law in Tampa like actually got her appointment here, like in South Florida here, like Broward. He actually found an appointment for her, and because he had to like wake up super early and do and like check it on Publix like all the time.
Mhm.
So she was able to get her an appointment. She was so reluctant to go. Like I actually ended up driving her because she was just like so nervous about it, and like she was kind of freaking out. I was like, yeah, I totally get it. Like it's a new vaccine, it's a new thing, it's pretty scary. But at the time, I already knew a couple of people who've already gotten it who were like my age because like like they work in like the medical field. So
Mhm. Mhm.
I was telling her like, yeah, they're fine. I've asked them, they seem to be okay. Like one of them was like partying immediately after she got it, so I was like, she's good. Um, so she got it, and then she got both doses, but she ended up getting a little sick after the second dose, and it was sort of weird because I'd never seen her like have like such a high fever before. I don't think I've ever really seen my mom sick, but she was only sick for like 2 days, and but she was totally vaccinated, and it was such a relief. Even after the first vaccine, you have a lot of um, like you still build up a good amount of immunity.
Mhm.
So my
Mhm.
sister from like Boston actually came and visited, and it was like a little like we were very cautious. We were always like separated. We hung out like outside in the patio. We always had like the windows open and the fans on. But just knowing that my mom, even though she was just half vaccinated, it was such a huge relief to know that because my
Mhm.
mom is high risk. She has very
Right.
high blood pressure.
Right. Right.
So it was such a like it just felt like a huge weight was just lifted off my shoulder that I didn't even realize that I was holding on to. It's just like so much shit was just happening with George Floyd, Corona, and just all this
Yeah.
stuff, and the election and everything. It was just so much, but just having that
Mhm.
like just that lift, just like I can breathe a little bit. Just felt so good. So honestly, I, you know, I think having vaccine passports, vaccine mandates is a great thing, and I think just being vaccinated is great too because it's such a weight being lifted off your shoulders just to know
Mhm.
that I have a really high chance of not getting a serious case of COVID because it was still nerve wracking that my mom was going into work, coming and going, and I was at home and I couldn't fucking do anything. And if she got it, and then, like, and if for whatever reason her case wasn't too bad, but mine was really bad, it's like, shit, I'm young, and that could just fuck me up for the rest of my life. And I just couldn't do anything. Like, like it's a very stuck feeling, and it's not good because you just never know what's going to happen. Everybody around you is just saying, oh, it's going to be fine. You'll be fine. You're healthy. Everything good. Everything's good. Everything checks out. It's like, yeah, but you still just never know.
Exactly.
Yeah.
Exactly. And to Superman's point, I got it. And I'll put it to you like this. It was not good. Actually, my whole household, everybody in my house had gotten it. And it was weird, too, because I remember sharing this once before. It was weird because not everybody had all the symptoms. Everybody had one of each of the symptoms, but we never all had the same thing. Mm-hmm. And the only positive out of that is we never had the fever portion.
Okay.
Which was like very good at the time, because again, even then the vaccine really wasn't out as much, but it was still kind of like circulating through our state and through the country and whatnot. And so it was more so one of those big signs of relief of like, okay, we had it. We didn't have the fever portion of it, so we didn't have to go to the hospital. But at the same time, it was just one of those things where it's like, I don't even necessarily call it nerve-wracking. It was just more so very irritating because we were stuck in the house for the most part. And I think the only time, because I got mine's like probably a day after Thanksgiving, probably 2 days after Thanksgiving. I remember calling my brother and telling him, like, hey, I think I messed around and got COVID. I need y'all to go get tested to make sure y'all didn't get it. And thank God, him, his wife, and all of their kids, they got it. They all came back negative. I'm like, cool. And so, but still, it was just that very irritating feeling. Like I said, I think probably the one time I actually went outside, speech impediment, leave me alone. Yeah, it was probably, I believe it. Mm-hmm. I believe it. Summertime, oh yeah, I believe it. The one time I actually had to go outside while I still had it or still going through with it was for me when I was paying rent. That was the only time I did. But at the same time, like when I was outside, I wore my mask. I definitely sanitized everything that I touched, just so nobody else who came behind me touched the same thing and got it. Like, I was that much paranoid. And even then, I still find myself still wiping down stuff, still using hand sanitizer, especially when I go to the store. Oh, I love Meijer for this. They have hand sanitizer right as soon as you walk through the door. Get a squirt, rub my hands. And even throughout the store, they have hand sanitizer. And I find myself doing it just because I just wanted to make sure, and like I said, it was not a pleasant thing. It's something I don't wish on my worst enemy, because it could have went a totally different way. It could have went a totally different way, And I feel as though that those people who refuse to get vaccinated and who refuse to wear a mask is like you're playing a gamble that you're not really going to win. Mm-hmm. You're really not. Yeah, dude, I haven't had that, but the sitting up in the chair portion, yeah, especially because that lower back. I know for me, my lower back was killing me. It was like somebody took something and was stabbing me in my back, and it would not let go. And even then, in order for me to sleep, I was popping like 3-4 Tylenol, extra strength Tylenol, just so I could sleep for like 4 hours at a time. That was irritating. Mm-hmm. That was the most irritating thing of the whole process was waking up in pain. And in trying to stretch and even still doing everything else to make sure I was still okay. It was still that irritating pain that never left until like maybe like what 2-3 weeks after. Oh man, yeah, yeah. I think one of my kids had that was sweating really bad. If it wasn't the kids, then it had to be the missus. But like I said, it was just really, really weird. It was really, really weird. And like I said before, if you guys can get vaccinated, go get vaccinated, and still wear a mask. Wear a mask. And I think PJ, I think he said it, but I think he said it before. He was like, school's gonna be a real test for sure. And to Mark's point, what do you think about the vaccine passports and the mandates? I think that the vaccine passports, I'm an Echo L. It's a good idea. It's a great concept because now is like I feel as though it's going to be treated as a very real thing, like a necessity, especially if you're traveling. That's going to definitely be, excuse me, that's definitely going to be required because they want to make sure that where you're going, that you're going to be good, that you're going to be safe, that you're not going to be the knucklehead that's going to spread this message to whoever you're going to come in contact with. And I feel as though that it would help kind of boost confidence knowing that you took every precaution to make sure you're good and make sure you're safe, and that you take your health seriously, but you also take the health of other people seriously. And so it's not the fact that your freedom is going to be taken away. It's not the fact that you're going to be restricted your freedoms. Like, no, it's like you're just being responsible. You're just taking that extra precautionary measure to make sure that you did your part, And I find it that if it comes to it to the point where if you have to go to certain places, that I wouldn't be surprised that might be required. But then again, it kind of does play in some sorts a little bit of a privacy, because I know at my church we were talking about it, and somebody made up a good point. It's like, well, if you think about it, it almost toes the line of if you're going to violate HIPAA in a weird way, because now you're saying now you're basically kind of not necessarily dip into their business, but more so making sure that are you really vaccinated in order for you to step in, and even then, that could cause a little ripple effect because not everybody inside of the church, not necessarily everybody's gonna be vaccinated. So it's like, what do you do then? And I see, and again, it's really weird because it's just one of those things where it's like, yeah, it's a good thing, it's a great thing, it's a great concept, but at the same time, depending upon where it is implemented at, it could get some backlash. It very well could get some backlash. Now, again, if you're traveling, that would probably be the one instance where I would say that would probably be implemented at the most, especially if you're going on like the airlines and you're flying, internationally. Yes, definitely. I could definitely see that happening. I could definitely see that being coupled with your actual passport, if not kind of superseding your original passport. I can see that happening, and maybe another way to kind of make sure that you are who you say you are. I can see that happening. But as far as like more so on a local level, I don't know. It's kind of one of those things where it's like maybe let's say if you have to go to like your doctor's office or a specialist, I could probably see it happening there where they're going to ask for your vaccination passport. I can see that happening there. I could see getting the vaccine or a mandate as far as getting the vaccine goes, especially where you work, depending upon the line of work that you're doing. Yes, in that instance, I can see that happening very much as well. It's just, again, as of right now, it's still fairly new. Still for it's still fairly new, and it is still going to kind of like be one of those topics it's really going to be discussed a lot. It's really going to be discussed. But can we get a drum roll, please? Hey.
Yo, good to see everyone. I'm sorry that I came in like definitely more than halfway through.
Yeah, because I was wondering.
I'm like, lucky. What did you say?
I was wondering, like, is somebody even gonna come?
Yeah, I was like, I want to still come, but it was gonna be a minute. But not to interrupt. I want to keep hearing what you're saying. I was playing the stream on my actual phone, so I was hearing the conversation.
You're good.
I did want to mention, Sibi Tabia did say, like, New York has made it mandatory for you to be vaccinated to have access to stuff like gyms. One of my friends actually visited New York a week or so ago, and they had already bought tickets to something, and was gonna go and everything, and then it's like they were showing the tickets and stuff at the door, and then the guy was like, and your vaccination cards, and he was like, oh, what? And he was like, well, we're vaccinated. In reality, he wasn't, but he was saying he was trying to like front to say he was vaccinated, and they were like, no, you can't get in. He was like really upset because he already bought like tickets to it and all that. And I think like maybe his family was vaccinated, or I don't know. So he was just really upset. But now he's really considering, like, yeah, maybe I should just get vaccinated. I'm like, yeah. Because I know like that's what's going to be the case for, for traveling abroad.
Yeah.
I know that I think if you go to London, if you fly to London, if you're vaccinated, you don't have to quarantine for 2 weeks. So like, imagine especially being an American with our shitty like time off plans that were not guaranteed. Like, okay, let me fly to London. You would have to take 3 weeks off of work if you're not vaccinated. You'd have to fly to London, quarantine in the hotel for 2 weeks, and then finally get to enjoy London. Like you want to go and start enjoying it immediately. So exactly. Another reason is like that's another reason to have it. How did they valid? Oh, let me back. That's why I was saying like it should be it would be a good idea if it were an app. So they could just scan it and it'll like show up. Oh, this is Elle. They're vaccinated. She has her face and everything. Like I'll have a picture of my face and something like that. Like I got my license renewed the other day, and they take pictures there. You got your vaccine card?
Yeah, the first one. This is the reminder part on the back. I had to get 2 vaccine cards because I forgot to bring the first one to my second appointment. So, which didn't really matter. They honestly, like, it was not really strict at all. So, and apparently you don't even need the physical card to get into certain places. Like I had a dentist appointment, didn't really get to do it. That's a different story. But I showed up. They said, they asked questions like, were you sick in the last 2 weeks, yada, yada. And I had a cold, but I was negative for COVID. I took a test. And they were kind of like, oh, well, you had to take like multiple tests and have proof of it, or you need a vaccine passport. And I was like, not a vaccine passport, but have the card. And I was like, I don't have the vaccine card. They said, do you have a picture of it? And I was like, I don't think I took a picture of it. I was like, I have a picture of me getting the shot that I posted on Snap. But thankfully, I was able to find it in my car. But if I didn't have it, I couldn't have gotten in. And I was like, really? So that was pretty low. That's like pretty, like it's a picture of a card that could be forged, and the picture could be also like fake. So the fact that you just needed a picture on your phone of the vaccine card, and I guess with your name on it, was a little shaky to me. But
maybe if it's like a picture of you holding the card and you can see like your name and everything, that's a little bit harder to forge.
Yeah, that's
better. Possible, but it's a lot harder.
That's definitely better. Like if you kind of like how a lot of verification, especially for like Bitcoin related stuff, they make you do all that hubbub to like basically verify your rail. Like, hey, I have a picture of something and it has some word on it that it told you to like handwrite. So you could do something like that with a vaccine passport. It'd be interesting.
Mm-hmm.
Yeah. Figure made a good point. Yeah, people are taking pictures of cars now just to get into places. Yeah, true. So true. I mean, man, it's just one of those things where it's like, yeah, it's bound to happen. It's bound to happen, you know. And I feel bad for your friend not being able to get into a concert.
I mean, I don't. It's been annoying that he wasn't getting vaccinated, so I'm happy that he's going to try to do this. I was like, why the hell aren't you? He was like, well, I think I must have gotten COVID, you know, at the end of 2019. I'm like, okay, and?
And
again, the reason why I feel bad for him because like the money he spent on buying them tickets, he can't get that money back. Like that's money lost, especially if it's like a couple $100 per ticket. Oh yeah, you can't get that back. That's gone out the window. But at the same time, it just does let you know that where you're going and especially what kind of venue you're going into, you're probably going to be better safe than sorry. Just have it. You know, might as well go ahead and get vaccinated and just have the card with you at all times. Excuse me, at all times. I mean, even on the card itself, it says, keep this with you at all times because you may have it requested upon whatever.
Say that, yeah.
Only reason why I know the missus has it, and like I said, the only reason why she got fully vaccinated is because she's a healthcare worker. Boom. Mm-hmm. But even still, it's just one of those things where it's. I don't want to say nerve-wracking. It's not nerve-wracking. It's not even irritating. It's just do what you got to do. At the end of the day, do what you got to do. At the end of the day,
it's like a mild inconvenience, you know.
Mm-hmm.
Like, because I mean, I was happy to get my shots, and like you know, it was hard to like try to sign up and make the time to actually do it because I was trying to do it very, very soon. But now, you know, just like 4 months later, now they're just like super easy to get to, you know, like,
yeah.
But it's just, I don't know, like, just go and get it. It's such a weight off your shoulders to just, you know, like even the Delta variant is like they say it's like 88%, like the vaccines are 88% effective against the Delta variant about. So, you know, that's just very reassuring. And yeah, considering like the flu vaccine, I think is 60% effective against the flu, but it's just even that little bit of protection is something. Exactly, it's a little annoying but necessary. Like nobody really wants to be doing this. I'm not fucking like looking forward to the next vaccine I have to get. You know, taking the time out, signing up, doing the thing, hoping I have health insurance. Whatever the hell in the future that time is. I don't know where I'm going to be in life. But fortunately, you don't even need health insurance to get this, so that's great. But yeah, it's just a mild inconvenience, but it's necessary. Exactly.
Yeah.
And you can help save lives, like you know, like a real hero. You can be a real hero.
Oh my gosh. Oh my gosh. Okay, next. Oh man. So, actually, I'm glad we're having this conversation because now going back to the one of the previous quotes. I know Elle, you mentioned this too. Like when you were saying like the parent who tells their child, you know, you don't need to be wearing a mask, like breathing God's air and whatnot. I know a lot of people kind of made fun at that. It's like, you know, yeah, but we talked about the political side of
Mhm.
this thing. What have you guys noticed about the religious side since COVID-19 has been coming into play? And even then, even if you're not into religion, that's still fine. That's still fine. You know, still just trying to have this conversation, this overall well-rounded conversation. Like, if you do, great. If you don't, still great. But still at the same time, don't let it hinder you from speaking your thoughts. But as far as the religious aspect, what have you guys seen that kind of like made you kind of do one of these numbers? Like, it just kind of question a lot of things.
I could say something.
Mm-hmm.
I found it very odd when like this. I saw a video of this one church talking about Lil Nas X's music video.
Right.
Call Me by My Name or something. Call Me by Your Name. I don't know. And with all like the symbolism and everything. There was a video of like a church, like I don't know exactly where it was. It was a predominantly white church, and nobody was wearing masks. And the and like it was pretty. It didn't look like a very big church. It looked pretty small. Like the pastor was, preaching and talking about this, and saying whatever the heck. And I'm like, you guys aren't wearing masks right now. You're talking about a music video, and I feel like now you're talking about a music video about something that was sort of just like an alternate universe that will never exist. Like no one's gonna take a stripper pole from heaven down to hell, lap dance on the devil, and then kill him. But like,
ouch! Oh, that's real.
But like, you're gonna sit here and talk about this music video about like, oh, what's gonna be, polluting our kids' minds, and I'm like, you guys are in a physical small space with no masks right now because somebody told you that this virus isn't that serious. And it's just like, it was just so, I don't know, just like hypocritical, ironic. It was like, I don't really know how to describe it, how to say it. It was just, I don't know, it just seemed very delusional because that's not really like a topic to discuss right now, especially in that setting,
Yeah.
Like,
It is funny because I remember watching that video, the message she showed it to me, and I sat in again. Nobody was wearing a mask, and he was like, "We're not going to be wearing a mask. Like, if you're wearing a mask, you can leave. You're going to get turned around at the door." I'm like, wait a minute, hold on. Like, dude, you're playing with people's lives. At the end of the day, you're playing with people's lives, and you being a pastor, that's crazy because again, you got to answer for that. You're gonna have to answer for that when you go and meet your maker. You're gonna have to answer for that. Like, why did you do this? What reasonable explanation do you have for that? And it's crazy. It's crazy. And Superman, I'm sorry that your church was a super spreader. That's oof. Yikes. That's all I can say is yikes.
In Palm Beach, Florida, I feel like I might have heard of something like that. Like a church was a super spreader.
Yeah, but still, it's just one of those things because even then, like even at my church, is like, even though we're like we don't have to wear a mask, we still find ourselves, we're still finding people who are still fully vaccinated wearing their masks, and it's like it's just one of those things where it's like, I would rather them to be safe than sorry. I would rather them be able and be in a position where they could still come and not be afraid of catching it, and like if anything, let this be the last place you'll get it from, period. Even if you did get it from here, at least let somebody know, like, hey, I got it from here, because now we got to pretty much decontaminate the whole church, make sure everybody in the church is tested, and yada yada yada. It's all sorts of things that are going on. Yeah. Ooh, yeah. I mean, that's unfortunate. That is very unfortunate, and it's crazy. It's very crazy, and there's so many stories I've heard about. I've heard like that, and it's just like it's annoying. It really is. It's annoying because it's like, what are you doing? This thing is very visible. Not visible. This thing is around. It's around.
And it's visible, I'd say so. Like it shows itself in different ways. Like,
okay. I'll take your point. I'll take your point. And so it's like, why not do what you mean? You shouldn't have.
I didn't see anything like that.
Who timed you out? Matter of fact, hold on. What did you say for you to get timed out?
I don't know. I didn't see anything.
What the deuce?
Like, we apologize. Like, we didn't do that. I don't know what the hell happened.
No, because I'm the only one that's I don't have any moderators. You said church, Twitch.
No, we don't.
Twitch, I'm gonna need you to get on your act right, okay? I'm gonna need you to get on your act right. Don't be muting my peoples. Don't be muting my peoples. They can have a right to say what they want to say.
Exactly. Well, Mish, you're our moderator, actually. So you tell us. Do we have moderators?
No. Actually, if that's the case, then I actually have to officially make him a moderator. If that's the case, I have to officially do it.
I trust Mish, so why not?
That's all, Toby. I trust Mish too. So
I vouch for Mish's character.
Yeah.
Okay.
I nominate Mish.
I will make that happen. So if Twitch coming after y'all, I'm gonna have a word with Twitch, because you should be able to. As far as the Melanated Council Twitch page, you should be able to say that. Hey, Chrissy! Oh,
hello.
man.
Hey,
we got RNC represented in the House, and no, it does not mean Republican National Committee. It does not mean that.
But you could have told us what it means. I mean, okay, if you can't say it on stream, I respect that. I understand. But all right, well, hello, RNC.
I'll put it in the private chat. I'm gonna put it in the private chat.
Yeah.
That's what it means. Can't put that on. Can't say that.
No, it's true.
Can't say that.
Okay, I dig it.
Can't say that. Can't say that on stream. Nah. No, we're gonna get this whole cowboy shut down.
Yeah,
y'all showing up. Y'all showing up. I appreciate the love, you guys. I do, for real.
I mean, it wasn't my first guess, but once you said you said maybe it's not something that could be said on stream, I was like, huh.
Yeah, no, I would have never guessed that. I would
It
have
was.
like, what kind of game? Like, I thought it was like a video game you guys play. I was like, what is it that's so secret about this game? Like, what could it possibly be?
No, it's just one of them things where it's like, man, when people, I can't even, I really can't even put this in the words on stream because it's a mouthful. It's a mouthful. It's a mouthful. I'll put it to y'all like this, probably off stream when I can gather my thoughts and just lay it out. You understand? But until then, yeah. Oh man, but still going back, you know, it's going back to the religion aspect, you know, it's just one of those things where like I said, I find it nerve-wracking where you have these pastors who are becoming reckless about what they're saying, and especially when it comes across the pulpit. And you have these people who are listening to you for guidance, for help. And even then, it's like you got to be careful because not everybody is out there to help you and lead you in the right direction. You know, same thing with politics. Not everybody's out there is. Why can't you drop subs? I don't know what's going on. I don't know. I will get that figured out. I will get that figured out. You should be able to. I don't know why you're not be able to, but yeah, you should definitely be able to. Like I said, I'll get that figured out. I know you. I know you. Not only that, yeah, that part that might be the case too. But even still, you know, sub up if you can, go for it. If you want to gift them, go for it. Do what you got to do. But yeah, I will get to the bottom of all of that on the Twitch side. I'll get to the bottom of that. So, anyways, no, not yet. We just got that. We just got that channel up and started probably within. Yeah. It's weird. Like I said, we had just got this channel started, not too long ago. Probably like within the last yeah, that's been in the works too. There's a bunch of stuff we got put in the works, but at the same time, it's like just trying to get all of that figured out and put together in a seamlessly way. You know, we're still a work in progress. We're still in the work in progress. But at the same time, that is one of the things we wanted to push forward from this year going into the next few years. So that way, if people want to donate, they can. If people want to sub up, they can. If people want to give subs, I know you, Superman, they can. You know, and just be able to make stuff happen. So, like I said, I'll get to the bottom of it. I'll figure out what we got to do and push it there. Yeah. Yeah. Oh, yeah. But once we get that follower count up, we're good. Yeah. I appreciate it. Thank you. So, man, yes. Oh, yes. This year is going to be awesome. Yes.
We can hope.
Yeah. But, man, I know we got, like, Mish, I know you. And then I know with Civitavia, and I know with Superman, Chrissy, I know she just joined in. I know y'all will get this thing rocking and rolling. I know y'all will.
Thank you, Mish. Yes.
We got y'all. But yeah, man, it's been a while. This whole second round has been a while. True. It's been true.
Sorry if I missed it, but how do we get affiliate? Oh, only 50 followers and 3 consistently watchers, or really? How consistent? Like for a month, for a week, like or two? Like how many days for it to be consistent, or how many streams rather? It doesn't need to be consistent. But yeah, definitely getting like 3. It has to be 3 Twitch followers consistently, and then 50. Do we have 50 followers on Twitch? Not yet.
Geez, hold on. I can't get the metrics up. Let me go here. Let me get the metrics because I was just looking at it not too long ago. Let's see.
Oh, we have
You
36
guys-
followers. Yeah. Thank you,
Oh,
guys.
36. Okay, thanks. I thought it.
36.
So we're close. We're like 14 follows away.
Yeah.
Oh, yeah, I'm pretty sure we'll get that quick. I'm sure we get that real quick.
Yeah, we could just keep promoting on
It won't take
Oh,
long.
you have to end the stream with 3+ watchers. Okay, that's interesting.
Oh, but how long does the stream have to be? Can we just do like a 3-minute stream and then like, can you guys last 3 minutes?
Hopefully, it can last at least. Were you thinking the thought that I was thinking? If you,
I know I did that on purpose.
oh, you did. Okay. Oh, just to clarify that we're all children here. That's fine.
I mean, it was definitely a double entendre.
Hey. The stream is 18 plus. 18 plus. Don't let your children. I mean, they can watch it. Honestly, it'll all go over the head. It'll be like SpongeBob or Phineas and Ferb.
Sometimes my nieces, I guess, watch it, and they're like all under like 12 years old. Sometimes my sister puts it on the big TV. I'm like, don't do that.
Oh no, not the children.
Yeah, or, like if it's like in their bedroom and they're just sort of watching it, it's like sure, but she doesn't put it on as much anymore. But she has 2.9 consistent.
What? Oh, so they really average it out. Okay, interesting.
Wow.
That's tough. You need just 0.1 per more of a person. Imagine.
0.1 of a person. But yeah, I didn't know becoming Twitch affiliate was that easy. I thought it was a lot more difficult. I guess it's like a different kind of like you can get custom emojis and things like that. I gotta look more into Twitch. I don't really know much about it. It's a little sad.
Twitch is cool. Twitch is awesome. I think Twitch is one of those where you're able to interact with your community and just be able to not only for them to get engaged, but for you to get engaged as well. So this is very unique in its own way.
Mm-hmm.
In its own way. I like it.
Yeah, I think the culture of Twitch is just really
yeah,
like community based for sure. Twitch, like that's what's the culture of it.
Oh yeah, very much so. Very much so. Cool. Got everything up and running. Boom, boom. Yeah. Oh man, this is awesome, you guys. This is awesome. However, as always, per usual, we got to bring this thing on home so we can get ready for the next task.
Yes.
Huh? Yeah.
I just saw all good things come to
Got
an
it.
Thank you too for holding it down because I really was having a lot going on. we'll just
fine.
we'll just say, but
We're a team. That's what a team does.
hearts,
Amen.
hearts indeed.
We got you.
Yeah.
We got you. We got you. And again. Oh yeah.
Wait, can you
Oh, yeah.
see those?
Summertime-
You can see those metrics.
Yeah, there should be like right there.
So
But no,
is it like the same 3+ watchers or?
It can be any 3+ watchers as long as there's always 3+ watchers. We should be good. At least 7 unique broadcast days in the last 30 days.
oh
Woo.
shoot. So that means you have to do it. Oh my goodness, because that would be even more than twice a week.
Oh, true.
Yeah, but then again, if you think about it, it doesn't always have to be like 3 in a row or 7 on. Yeah, it can be spread out. Mm-hmm.
Oh, I thought it was like any of the 4, like at least 500 total minutes broadcast in the last 30 days. 500 minutes? How much
Wait,
is that?
500 minutes. That equals 7.
12 hours. No, that's not 12 hours. I'm thinking of 600 minutes. Or am I thinking of 5? I don't know. I don't know how to do math. Excuse me.
I feel you. Like
Like lately, I used to be so much better at this.
basic
80
math slips when you get older.
83 hours divided by 24. That's 3 days. Okay, so, well, I guess 84 hours in a month and 30 days. You have to really do 84 hours.
That's easy. If you think about it, that's doable. That's doable.
Okay, let me do 84 divided by 30.
So what's this? I guess I have to look at the link that.
Like 2 hours. That's like 2.8 hours a day in 30 days.
So it's 500 hours over 30 days is what they're saying.
No, 500 minutes.
500 minutes. Sorry, yeah, I meant 500 minutes.
Mhm.
So 500 minutes over 30 days. Isn't that just?
Oh wait! I did my math wrong. 500 divided. What? So, I apologize, guys. So
I was like, wait a second. I was like 2.8 hours.
yeah,
but-
I guess I maybe I did 5,000 divided by 60 at first. But the one that was like 83. So
Oh, okay.
500. Yeah, 500 divided by 60 is 8. Okay.
Wait, divide by 60.
Minutes. 500 minutes divided by 60 minutes.
Oh, you're trying to convert that to get the hour.
Right. Yeah.
Oh, sorry. I thought you were dividing by 30 to get like an average of how much you need to stream per day or something, or divide by 7 to get the per week amount. Okay, I got it.
All right. Sorry, y'all. Actually, like in my defense, I've been taking this business class for like the past 9-10 weeks. Actually, this Thursday, the class is finally done. And I had to, for my class, I had to interview 10 people a week for 9 weeks. And I literally just finished today. I've interviewed 91 people. So
Awesome.
yeah. So
Sorry, I was laughing because of that comment, but I do know that business thing.
Oh man.
But yeah, like no, I feel so 8 hours. Yeah.
Well, Jody, we know that the passports doesn't prevent the spread. We get that part. And no, we already discussed it's not the government trying to take more rights from you. It's more so you doing your part. You know, if you don't want to do the passports, okay, then at the very least, wear your mask. It works hand in hand. It just works hand in hand. You know, either you're going to do the vaccine passports and wear your mask, or not do the vaccine passports but wear your mask. Either way, you're still going to have to wear your mask. So whatever, dude. The data does show at the mask does work. You know, it works.
And I was gonna jump into and say, I think vaccine passports, because I was like not here for all the earlier conversation, but vaccine passports have mostly seemed to be a non-governmental thing. Well, I don't know how quickly that's going to shift, but in the beginning, Biden and the White House, a lot of people were sort of taking out that, like, they were trying to take out the,
oh yeah,
what do you call it? They're trying to take the oxygen out of, like, yeah, vaccine passports. We're going to let private companies touch that. Any private company, like airlines or like the workplace that wants you to go back, they're the ones with it. So it kind of at least made it much more of like, okay, you can say what you want about the idea of a passport, but it's at least not like the government collecting your data. I don't know quite right now what's about to happen, because New York City did just decide to mandate that you have to have a vaccine. And of course that's city government, right?
Yeah.
But I'm skeptical too that, like, I don't know, they're going to control you XYZ. Because I think you can be subject to frequent testing, and you don't have to give your data that way if you don't want. But
I mean, there's ways. There's ways. I mean, granted, yes, the passport doesn't protect you. I mean, I get that. I get it doesn't protect you. But at the same time, just keep in mind, because again, I know with me and my family, like, we want to be able to travel like overseas. And so I know that in order for me and my family to travel overseas, not only do we have to have the typical passports, that you get your photo taken at the post office or at Walgreens, and you get put on the U.S. passports, and you can go whatever. But also at the same time, that we're going to be required to have our vaccine passports in order for us to go to whatever said country. It doesn't protect us, but at the same time, it does ensure that where we're going to be protected. It ensures that we've done our due diligence.
You've done the best that you can do.
Yeah, and even if we do mess around and contract it, okay, we're not going to be severely ill as if we didn't have the vaccine. I'm gonna put it to you like this. It's like having a gun. It's better to have it and not use it versus being in a situation where you need it and not have it.
Yeah.
I look at it like that. And Elle said it earlier in the stream. It's better to have it and not need it versus to be caught in a situation where you need it and not have it.
Yeah.
Right. And we've all been in situations, even like big or small, where it's like, oh man, I saw it. It was on my bed. Why didn't I just pick it up? I need,
yeah,
or something tiny or whatever.
Yeah, and I even equate it to, like, having your wallet, or having a purse. Same concept. You may not need your wallet, but at the same time, you have it with you, so just in case, if
having a lot of guns is so much better.
Go between me and him. Stop it. It's like having a person having a wallet. I would rather have it knowing that I have everything in my wallet, so just in case if I get pulled over by the police, here's my ID. Or if I'm going to go do some shopping, here I got my debit card, I got a credit card, I got cash.
You might just want to run out real quick to like pick up something at at the drugstore or whatever, and you're like, well, I don't really need everything. Let me just carry $20 and nothing else, and then you never know what could happen. You get pulled over, or I don't know, you might need your ID for whatever. It's like, oh, this thing requires an ID for you to purchase it now. And you're like, what? Oh shit! And I have to go all the way back home.
And don't get, and please don't get it wrong. We're not getting on you. We're not. And again, like I said, we're agreeing with you that the passport doesn't protect you. We get that, but at the same time, it's the vaccines that does. And in order for you, especially again, if you're trying to travel overseas, it's that one thing that's going to ensure you that yes, you can travel overseas. Or even because I know Elle, she brought up a wonderful point that you're going to be at, if you're buying a ticket to go to a certain venue, most venue places, they're going to require to see your passport, your vaccine passport, in order for you to get in. And
At least
even,
at some point, you know.
yeah, yeah, and so if you get caught in a situation where you're going to Madison Square Gardens to see Jay-Z in concert, and you already paid like $200+ per ticket to go in, and they tell you, do you have your vaccine passport in order for you to get in? No, but I'm fully vaccinated. Well, we can't let you in without it. Even though yes, you paid for the ticket, we can't allow you to get in because that's what's going to safeguard everybody else to come in.
Because your vaccine card is your only proof that you actually got vaccinated. Like, you can't just look at me and tell, these emojis could just be straight up lying. But I really did get vaccinated. But that's really your only proof. And it's not like a guaranteed, like safeguard, but it's just the most that we can do, at least at this point. I think there's we could do more. Like I said earlier, I wish there was some sort of app, because it's easy to forget your card. It's not, it's it's shaped unfriendly in terms of where the hell can you put this? You can't put this in a general wallet that men usually carry.
Yeah.
You can't, it's just very odd. But if there was an app on your phone that was just a QR code that they can scan that shows hey, the person's vaccinated, and there's proof. I personally just wouldn't mind, because I understand what the end goal is.
Yes.
It's okay, I'm vaccinated. Here's my proof. I'm trying to keep the people in the venue safe in case they can't get vaccinated for whatever reason, or they're just so immunocompromised that even if they are vaccinated, it doesn't really matter, or there's a million reasons as to why people would want their venues to just be as safe as possible. Who wouldn't?
Yeah. Go ahead, Al.
Huh?
I was gonna say, because you know what, it actually brought back to my remembrance when I was working for a construction company that specifically dealt with relining the sewer lines. Okay. And because of the fact that I was actually going to be working in the actual sewers, I was told that in order for me to actually do that portion of my job, I would have to get my hepatitis, I think it was my hepatitis C, hepatitis B vaccine. Okay. I had to get it. In order for me to go into the sewers, I had to get it, because I was dealing with God knows what in the sewer line. Okay. Right. And so I'm okay, cool. I get it, whatever. So went ahead and made my appointment, talked to the doctor. He's yeah, so you're going to come in and get 2 shots. You're going to get one for the initial, but then you got to wait a few more days to get your booster, then you should be good. And so okay, cool, great, no big deal. And so when everything was all said and done, I got a card that, for whatever reason, it was easily foldable in order for me to fit in my wallet. Why this COVID vaccine passport is not like that beyond me. Anyway.
I don't know.
Anyway.
I don't know. There could have been some sort of I don't know. After you get your second shot, then you can get maybe a smaller card that could fit into your wallet, but you still have your big card in case you need a third or fourth shot, which I understand. I don't know. There could be something. I don't know. There needs to be something to make it more user friendly, essentially.
And again, Jody, yeah, and Jody's being a brick is making a very valid point. And it's not necessarily, it doesn't necessarily cause us versus them, because again, I'm still not vaccinated. I'm not. even though Elle and Toby, yes, they are. I'm not vaccinated. I don't feel a them versus me. I don't feel that because I understand that they had to do what they had to do. At the same token, and at the same time, I know for me in my household, not everybody in my household, they're not fully well, with the exception of my wife. Okay, she's the only person in the house that's fully vaccinated. Why? Because of her job. That's the only reason why. Other than that, even still, there would have been a really strong possibility that she may not get the vaccinations right away because of the fact that our younger two children, they're not going to get it. They can't get it as of right now. They can't get it. And so it's going to be like, I would rather for all of us to be vaccinated versus, a handful of us to get vaccinated, because even then, again, to your point, let's just say me and her get vaccinated and the other three, they're not, we can spread it off to them and who knows what's going to happen. We don't know, especially with this Delta variant that's flying around. Yes, to prove your point, yes. People that are vaccinated, they're getting it. People that are unvaccinated, they're getting it. The difference is those who are vaccinated, they are not being hospitalized as long or even as much as those that are unvaccinated. Those that are vaccinated, they're having milder symptoms. Just like when the COVID-19 first came to the United States, you had people who had mild symptoms and weren't in the hospitals. Then you had those who caught it and they had full-blown the worst symptoms in the whole wide world and they were hospitalized, And so it's just that added precaution that, yeah, you should get vaccinated, and even still just to make sure that you're doing your part, like, yes, wear your mask. That's been proven to be a proven success on top of the vaccinations, which helps, but again, it's that security. If all else is really that security, is really that sense of security. And again, like I said before, once the vaccinations are opened up to my younger two kids, I have a really strong feeling that not only will I get vaccinated, not only will my oldest get vaccinated, but the younger two, they're going to get vaccinated. We're going to be good. So we ain't got nothing to worry about. But at the same time, we're not going to not stop wearing our masks. Like, oh, no. Oh, heck no. We're going to keep it because of the fact we've already had it once before. We already know what it feels like. Now this Delta variant flying around is going to be like, okay, let's continue to do our part and let's continue to stay masked up. Let's continue to sanitize. Let's continue to do what we need to do to make sure we don't get it. But even still, we could do everything right like we did the first time. Done everything right. We still got it. But at the same time, because now we're just going to be dealing with the mild issues of the Delta variant versus the other side of it, we're going to be all right. So again, it's not necessarily creating the us versus them. It's just more so saying that, hey, do your part. And again, I don't know what your household is. I don't know what your situation is at home. That's for you. And again, Elle, she had her reasons. Toby had his reasons. Me, I got my reasons. Pretty much everybody and everybody's watching, they have their reasons why either one, they are vaccinated, or two, whether or not. That's on them. But at the same time, we still got to do what we got to do. At the end of the day, we still got to do what we got to do. And for the most part, it's just mask up. For the most part, mask up. And then if you want to get your vaccine, get your vaccine. Because at the end of the day, there's going to be a point in time where it's like, if you're going to do any kind of travel, if you're going to do any kind of whatever, it's probably going to be requested. If you're vaccinated, you can come in. If not, sorry, we can't let you in. It sucks, but at some point, it may come to it.
Right. No, it's true. Like, and I'll say this real quick, and then we could I'll go to our bits. Like regarding Jody's us versus them comment. To me, I feel like we haven't created. That's not creating an us versus them, because that's already been created to me a long ass time ago. Like personally, with the us versus them, where the you can wear a mask versus you shouldn't wear a mask. You're a sheep, or you're scaredy cat, or whatever the hell the buzzword was of the week. But like, if you're an establishment, and I've always believed this, where establishments should make the rules for like their company, their establishment, or whatever. I think the establishment, your business, your company should be able to have the rules. Like if you're a restaurant, you should ask like, hey, like if they're vaccinated or not. Like I understand like some people may feel like it's like a breach of like like HIPAA and all that. I don't know, because like we're in a very detrimental time right now. Like this is very concerning. This is a very spreadable virus. This isn't like every other day.
Right.
Like I always try to like see it as like, let's say that if like somebody comes running into your town and like their clothes are all burnt up and like they look like they're just on fire, and they said, yeah, there's a fire breathing dragon coming down. Like be aware, try to do whatever it is that you need to do, and nobody does anything, then that city is kind of like at fault. So or that business or whatever is sort of at fault, when they're like, there might be people in the business who are kind of afraid. Silly analogy, but like the point still kind of stands, where like we're in a dire situation. We can't just act as if this isn't happening. Just it's like, oh, we're going to create a culture where it's going to be us versus them. Like that's already been happening. That's been happening pretty much since the beginning of time.
Yeah.
Like this isn't like anything new, but this is to protect people's lives. It's not. I don't think it's really discriminatory. I can understand if like you're not gonna bake a cake for a gay wedding, discriminatory, because that's not really like life or death. But if you feel that's like against your religion, then there's nothing really you could say or do. Just don't go to that. Like if you're gay, don't go to that cake place, or if you're an ally, like just don't support that particular place. Like if you're upset that this place requires your vaccination card,
Don't go.
Yeah. I would feel very comfortable going to a place that required my vaccination card. Like I would prefer that, honestly, because it's just another peace of mind. It's just another layer of peace of mind. I'm not going to sit here and think, oh, I'm better than so-and-so, blah, blah, blah. Like there's going to be people thinking that regardless. There's people who've never worn a mask who sit there and think, oh, I'm not a bitch. I'm brave. I'm a man, or a manly, or, I like to, breathe the crisp, polluted air of America. But like that's always going to be the case. There's always going to be an us versus them. This isn't the thing that creates it. It's just like we are in a dire situation where your irresponsibleness can affect me and my family and my friends and my livelihood and just my community. So I want to protect that. It's a shitty situation. Yeah, you're not actually physically going out and like stabbing me or, shooting me or anything, but your irresponsibility of this very unfortunate situation. Like it sucks that, just existing near somebody can get you a disease, a virus that could kill you or kill someone that you love. Or someone that knows someone that they love, like you don't know how this is going to really get passed down. So, this is why, I like, just to give me the peace of mind, it's like, okay, I know that everybody in this establishment is vaccinated. I feel better. I wish everybody could get vaccinated. I wish everybody could get masked. I wish the cases would go down to zero. I wish that badly. But that's just not the case. That's just not what's happening. And, it's like, what is it that we can do? Like, at this point, like, we just don't really have a choice to create, like in your words, like an us versus them, which I don't really feel is the case. It's just, what can we do? We're supposed to just try to kumbaya and live with each other when people aren't taking a serious virus seriously. Like that's just, it's like living next to somebody whose house is burning down. Like that fire is eventually going to go to you. You want to help that person. You want to be like, hey, do you need? It's like, I got the hose out here. Do you want me to help? And it's like, no, we don't believe in the fire. And or like, it's like, or whatever it is. But you're like, well, we need to take this fire out because this fire can get to my house too, and then that's going to affect me. Like, we have to take care of this. And then if I start protecting my house and then people start coming over to my house because they know it's not going to get on fire, I'm not really creating an us versus them. I'm just trying to protect myself and my own. So,
yeah,
it's like, I can only do so much. I can't control you.
Facts.
But,
True.
Facts. Facts. And again, at the end of the day, eventually we're all going to have to get vaccinated. Is it going to be an outlier where not everybody's going to get vaccinated? Of course, that's going to happen. But at the same time, as Elle said, you can't control you. You do what you got to do. Whether it's being vaccinated or if you're not going to get vaccinated, wear your mask. Either way, either or. Hoping you can do a combination of the both, but either or. Still do your part.
Yeah.
At the end of the day.
What was that you said, Al?
There's only so much we can do.
Yeah.
There's so much we can do day to day. There's only so much that businesses and establishments can do. So it's really shitty when, like local or state governments are being like, no, you can't do this. And it's not for the reasons best for the people. It's just the reasons best for their own voter base and their interests. That's literally it. Just so they can hold on to power. Because if they really believed in like, what is it like? What is it like? That's pretty much like capitalism, like small government, big. What I can't remember. What it like free market? I think it is. Or it's like pretty much like the rules of capitalism, almost like small government, free market, or something like that.
Yeah, it's free market.
Yeah. So if they truly believe in a free market, then like a business owner should be able to do what they feel is best for their business. So if they say that, well, people in New York are requiring it, I don't see why I can't. It's a free, it's a free market. It's a free country. I should be able to do this. As a business owner, I don't see anything wrong with that. But if the government's really trying to crack down and say, oh, you shouldn't be allowed to do that, I think that's just very odd because, like we're in a dire situation.
Right.
This is different times. We can't just sit here and act like, things are exactly the same.
Everything's fine.
We wouldn't need masks. We wouldn't, be vaccinated. We wouldn't have, the shit being talked about all over the world on the news because it's not just in America that it gets talked about. It gets talked about everywhere.
Right.
Like this is different times. So, like desperate times call for desperate measures. Like this is. If all you need to do is just show that you got vaccinated, if that's the most desperate measure you have to do, then
the snark.
I love it. That's hilarious. But
yes, Mish.
But yeah, desperate times calls for desperate measures. You know, when it comes to anything, like if you, I don't know, like if you got into a serious car accident, you're not going to just try to walk it off and try to go back to work the next day and just be like, whatever. Like, no, like
tis just a flesh wound.
Right. It's like, no, my arm is broken. It's like, I need to go to the hospital. You need to do things now. Like, shit's not exactly the same as it was before. I don't know what to tell you.
True. So true.
The free market decide which viruses I get.
Jeez. Well, oh man, that's going. Toby, do you have anything to add before we wrap this bad boy up?
I was gonna say I'm gonna go to the. I'm gonna figure a way to troll the establishments. I don't know if this came up, but the establishment that is mandating or rejecting people who got their vaccine. I don't know if I want to spend money there, but it might be interesting to like troll them, pretend that you didn't get the vaccine, and then flash your vaccination card at the very end. Like, are they gonna kick me out after I had my meal? Please, please do. Please kick me out after I eat my meal. I'm gonna flash my vaccination card and say, "What? Do something."
Were you gonna complain how? Oh, I shouldn't have to show my vaccination card and like just be like an arrogant like patron.
You're what's wrong with the country.
It's like, no, I have a right to be here. I'm vaccinated.
Jeez. Oh, here we go.
Yeah, that's like, I can't believe. I don't know how many other restaurants or businesses are going to start saying that. Like, oh, if you're vaccinated, you can't come in. Like they have the reverse Uno card, and they're just like, boom. They just were like, we're gonna flip it on them. Yeah, really cool.
Vaccine card should be a reverse Uno card.
Oh, you gonna get L? You about to start something else.
we about to get onto our third hour here.
Yeah, not Uno.
He said no.
Dead. Oh man, yeah. All right, y'all. We're gonna let you guys go. RNC in the building. I appreciate you. We all appreciate you guys for showing up. We love you guys. Of course, Mish, we love you guys. And then
Always.
our followers on YouTube, Jody. Thank you for the conversation. Whatever you do not think that we're getting on you. No, we want those perspectives and we value those perspectives because again, we don't have all the answers. The conversation is needed. And again, at the end of the day, as long as we get to a middle point where it's like, okay, I see where you're coming from, we see where you're coming from. At the end of the day, if that's all that happens, cool, great. That's a dub. I count that as a dub. And anything outside of that, chalk it up as an L. But for Jody, for Jay, I know Chrissy showed up. Who was the other one? Kendra.
Yeah, thank you, Kendra. I'm assuming Kendra came on from being basically I met Kendra volunteering for a candidate, a local candidate in Massachusetts running for the House, who actually ended up apparently being an Andrew Yang supporter. I didn't find that out until afterwards. While the candidate didn't win, it was pretty cool. I just held signs. I'm not going to pretend like I did a lot. I held signs at a polling place on election day. God, that day was a lot. But Kendra, you're a real one. Oh, snap.
Here we go. Stop telling my secrets. Superman, stop.
What's happening?
Stop. I tell you, hush. Next time I ain't buying you over for dinner.
I'm dead.
But anyways, we gotta go. We gotta get ready. We gotta get planned for next week. So hopefully you guys tune in. again, we'll figure out how to get that that subscription going and hopefully hit affiliate. That's the goal. That's the plan. So at least that way, my man Superman can come in and do what he do best and just rain terror of subscriptions to everybody. But we appreciate you guys. And again, come back next week. Same channel, same time, same trio, different topic, and we'll go from there. And again, we appreciate the conversation. Night, friends.
And let us know on Twitter or wherever what you're interested in seeing in another week.
True.
So, tag us.
True.
We'll tag maybe the main TMC or account, but we without y'all we have no stream. So we definitely would love to hear what you're interested in hearing us talk about in the future.
Duh.
What is Yeah, you're gonna put something on?
Boom.
Oh yeah.
Yeah.
Yes, we got commands. Oh,
I love it. I love it. Bang TWT.
Yes. So check that out, and then just again, please let us know what you guys want to hear or a topic to talk about, discuss. Again, we'll take it and we'll run with it. We've had some socials. Do we have a social? I don't think I have a social. No, Superman, I ain't got social yet. We ain't got social yet. Points. There we go. We got points. We got watch time. Yes.
0 seconds.
0 seconds.
Wow. Really?
Oh man, we gonna get this thing up and running. I'm telling you, if it's not the last thing. Yeah, if it's not the last thing,
caps. Oh no. Yeah, I don't use Twitch, so I really don't understand how to.
I like everything that they're talking about. I get it. I understand. I just got to dig in and do some stuff. I just got to set time in my already chaotic, busy day just to devote on doing that. Like,
yeah, I feel you. And I don't even have kids or a wife, so I can't even imagine, Ron, what you're going through.
You know what? I can't even say that. That's just wrong. Superman, I appreciate you for acknowledging my cooking skills. But I gotta go. We gotta go. We'll catch y'all later. So again, our YouTube supporters, thank you. Our Twitch supporters, thank you. Our Twitter/Periscope supporters, thank you guys as well for showing up. As always, we love you. We will catch you guys next week. Until then, I'm about to whip up something real nice. And no, you ain't good. You ain't get one. Yes.
All right.
Stay blessed. Good night, everyone.
Stay safe.
Good night.
Good night.